Thank you, Tom, and good afternoon. Today, I am pleased to report 5,710 Albertans have recovered from COVID-19, leaving 926 active cases in the province. Currently, 59 people are hospitalized with COVID-19, with 6 of these in intensive care units. In the last 24 hours, out of 4,017 new test results, there were 33 new cases. Sadly, I must report that there are 4 new deaths today: a male in his 70s, a female and a male in their 80s, and a female in her 90s. All of them resided in Calgary continuing care facilities. I have said before, and I will say again, that no Albertan is expendable, and every death from this virus is a loss of someone who was loved and cherished by friends and family. My heart and condolences go out to all Albertans grieving the loss of a loved one at this time. We do know that older individuals are at higher risk of severe outcomes from COVID-19. The average age of those who have died from COVID-19 is 82 years, which is why long-term care and other continuing care facilities remain a priority for both me and Alberta Health Services. We will continue to monitor outbreaks at these facilities and take additional measures as necessary to protect the health of residents and staff. The good news is that we continue to see a downward trend across the province in active cases. While it is too early to see the full impact of the relaunch, so far, our case numbers have held steady. A large part of this is thanks to you and the sacrifices that you have made and continue to make. I know many of the public health measures we've put in place have meant hardship for many. We did not make these decisions lightly. These decisions were made to save lives, and thanks to you, we are saving lives. I know that many Albertans, especially those in Calgary and Brooks, continue to be concerned about the more gradual reopening compared to the rest of the province. I understand residents and businesses are eager to see more businesses resume operations, and that the wait is taking a toll. I want to thank those in Calgary and across the province for doing their work to protect others by following public health measures, and that is a large part of why these numbers have continued to decline. Protecting Albertans' health and well-being is at the forefront of every difficult decision that is made. We do not want to jeopardize all that Albertans have risked and sacrificed by reopening prematurely. There are many businesses already open across the province, including in Calgary and Brooks. Reopening gradually allows us to monitor any increase in spread from open retail, daycares, and other activities in Calgary and Brooks where the baseline rate was higher last week. This sequencing is based on a thorough public health risk analysis that considers both the risks to the public of spread of COVID and the economic impact. At this point, we are not seeing a concerning increase in numbers in Calgary or Brooks, and overall our cases are stable. The major outbreaks at the plants in both High River and Brooks have made a sizable contribution to the overall case numbers in both of those cities. At Cargill, there are now only 5 active cases, with 943 recovered. At the JBS plant, we see similar progress, with only 10 active cases and 640 workers recovered. All of these signs are encouraging, but the next few days remain critical. Should we continue to see these encouraging results, we are hopeful that we will be able to move forward with the gradual reopening in Calgary and Brooks. However, progress on our relaunch plan continues to depend on our collective ability to keep infection rates low as we begin to relax public health measures. I continue to remind Albertans of the importance of responsible action. Albertans have pulled together to support one another through this pandemic, and that support remains as essential as ever. We are in this together, and we will get through this together. Thank you, and I'd be happy to take questions.
All right, operator, could you put the first one through, please?
First is Michael King with Global TV. Go ahead, Michael.
Hi there, Dr. Hinshaw. Just on the number of deaths, as we see the cases really drop off, we're still seeing spikes of 4 deaths every week or so. Are these cases that have been sick for a long period of time, other contributing factors, and just what do you kind of make that as we're kind of 1 or 2 days ahead of planning to talk about Calgary's next stage of reopening, that we see this jump in deaths?
So it does sometimes take us a little while to get reports of deaths. So sometimes these deaths have happened over the past few days, but they only get reported to the ministry as that reporting system kind of works its way through. So in this particular case, although 4 cases were reported today, the actual deaths may have happened over the past few days. I also think that it's important to note that the outcome in terms of how severe an illness is and whether or not that worst case outcome happens where someone passes away is in large part dependent on the age and previous medical conditions of the person who's infected. So we do know that there will be more deaths. As long as there are infections, there will be a small proportion of those who unfortunately go on to pass away. And that's why we need to be particularly vigilant about protecting people in long-term care and continuing care facilities and protecting those of our family, friends, and neighbors who are older or who have chronic medical conditions, because those are the individuals who are at the highest risk of death. So again, I think those 4 deaths being reported all together on the same day could just be a reflection of reporting patterns, but also a reflection of the ongoing challenges we do have in some of the continuing care outbreaks in the province, where we're working very hard to control current outbreaks and prevent future ones.
Operator, could you put through the next caller, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. At what point could the no visitor restriction at hospitals be eased?
So the no visitor restriction in hospitals is a measure that has been put in place by Alberta Health Services, and that's something that lined up with the restrictions we've put in place in continuing care facilities that are under an order that I've put in place. And so I think that the question of the hospital visiting restrictions is really one that Alberta Health Services is wrestling with right now, and I think that the factors that go into determining whether or not to ease those restrictions and how much to ease them are going to be about how much circulating virus we see in community, and again, the ability of the hospital system to be able to protect the patients that are in their care. So that's something that ultimately, again, would be an AHS decision.
Operator, could you put through the next question, please?
Next is Terry Reese with CBC. Go ahead, Terry.
Yes, thank you very much. Hi, Dr. Hinshaw. Just wanted to talk to you about a decision that's been made by the Alberta Energy Regulator to curtail monitoring of environmental activities. So the question is, can you talk to us about the sort of health concerns that are behind this decision, and why would environmental monitoring be curtailed while at the same time work camps would be allowed to continue?
So I'm sorry, I don't know the background to that decision. So that might be something that I need to learn more about and then get back to you. But that's not, I don't have that information right now about the background to that decision.
Excellent. And Terry, we can connect you with someone maybe in Environmental Parks who may be able to provide more additional information, or from Energy. Operator, could you put through the next question, please?
Next is Sammy Hudez with Post Media. Go ahead, Sammy.
Hi there, Dr. Hinshaw. Yesterday, the provincial government announced that the legislature would resume sitting regularly starting May 27th. I'm wondering if you're providing guidance on how this will work. What measures would you want to see in order for MLAs to be able to respect physical distancing when they're back sitting regularly?
So the legislature, like any place of business or activity that is opening, does need to consider the guidelines. We do have general guidelines for businesses and other kind of places of activity that would include the requirement for people to be at 2 meters distance from one another at all times, for hand sanitizer to be made available, for there to be some mechanisms to ensure that if anyone is ill, that they don't attend, and to make sure that there is consideration given. So if people are needing to be within 2 meters of one another, they're not able to maintain the distancing, that consideration be given to wearing of masks. And so all of those things, just like they would apply to any other place that's opening, those would also apply to the legislature.
Operator, could you put through the next question, please?
Next is David Staples with the Edmonton Journal. Go ahead, David.
Well, Hi, Dr. Hinshaw. Yesterday I was asking you about the triggers for reopening and shutting things down, and you mentioned an increase of 5% a day for 2 weeks. And in terms of when I was looking at these numbers and kind of projecting into the future, it looked like essentially that means that in the 2 week period, we would be doubling the number of hospitalizations, just to put it in the vernacular. Is that kind of what you're looking at, that over a 2 week period, if you saw kind of a doubling of the number of hospitalizations, that would be a clear signal to you to put in new restrictions?
So I think that those triggers were put in place with respect to that relaunch and calculating when we might need to pause on moving forward. I think that one of the important things in terms of that 2 week 5% day over day indicator is the trending of that. So I think, again, it's the important thing when we're looking at that trend is to see whether or not the hospitalization numbers are continually going up over that 2 week period where we're seeing that rise. We also know that if we are seeing that kind of rise in hospitalizations, that would be an indicator of a much higher proportion, or a much higher number, I should say, of active cases in the community, because there's only a small proportion of cases that do need to be hospitalized. So again, I think it's not so much just a straight up doubling, it's actually that we'd need to see that trend be a continuous trend throughout the 2 weeks, with the numerical threshold as well as that continual increase being met. And once we move through relaunch, I don't think that we can say with certainty, if those triggers, how they'll be used after we move into relaunch and we've been able to open up again. I think that would be a decision for the Emergency Management Cabinet Committee about whether or not, once we've fully opened, if it would be those same triggers that would require movement into more restrictions. And again, I think those are going to be things we'll have to discuss, because what we know about the virus now is that we're being cautious. We're wanting to make sure that we do continue to have that capacity, but what we want to make sure that we do is take into context whatever additional information or resources we have at a future date. So, for example, if there is a medication that's determined to be very effective against COVID, or if at some point in the future we should have a vaccine, then ideally we would be able to factor that into our decision-making process. So again, the triggers are specifically for this relaunch time.
Operator, could you put through the next question, please?
Next is Bridget Moore with Post Media. Go ahead, Bridget.
Good afternoon, Dr. Hinshaw. Thank you for taking my question. With the warmer weather, many children and parents are itching to get to their local playgrounds in their communities, but there's some confusion as to what's allowed and what's not. Are playgrounds only opened if under supervision or restrictions of some kind? School boards, for example, don't monitor their playgrounds outside of school hours normally. So if someone chooses to attend a playground on a school ground, is it at their own risk? Can you give us some clarity on the issue?
Sure, absolutely. And we have posted guidelines for the ability to reduce risk while using playgrounds. So I think parents who are looking for that kind of information can find it on the alberta.ca COVID website. But in terms of the framework for playgrounds, so some municipalities may have chosen to keep their playgrounds closed, and certainly municipalities have the ability to do that. And school boards may make a similar decision. However, where the playgrounds have not been closed, what the public health advice is that there would be some risk potentially of using playgrounds. We are not requiring the owners of playgrounds, whether that's schools or municipalities, to clean and disinfect playgrounds. Rather, what we're doing is providing the advice and guidance to parents about how they can reduce the risk of using playgrounds and making sure that they're aware of measures that they can take, and then assessing what risks they're willing to take with respect to their family and their kids. And so again, that guidance is available on the alberta.ca COVID website.
Bridget, I can send you a link after this is done. Operator, could you put through the next question, please?
Next is Sean Frenette with CTV. Go ahead, Sean.
Hello, Dr. Hinshaw. The city of Calgary tells us that the outbreak at Cascade Recycling has reached 45 cases. That's about tripled in the last 10 days. How concerned are you about that outbreak? And could that outbreak affect, as you mentioned, you're going to be carefully watching the situation in Calgary over the next few days to determine whether we can move ahead with further reopenings. How will that factor into that decision, and how concerned are you about that outbreak?
So the numbers I have about that particular site actually are 53 cases associated with that outbreak, 16 of which have recovered. So we're not seeing necessarily the same kind of really steep increase that we've seen in other large outbreaks. Certainly 53 cases is concerning, but Alberta Health Services has been working with that site and offering testing to all those who are on the site, whether they have symptoms or not. And so as we've seen in other outbreaks, I don't have the breakdown of how many of the 53 were symptomatic or asymptomatic, but what we have seen in other outbreaks is that sometimes the asymptomatic testing can increase the overall numbers, but actually helps us to get that outbreak under control because we're able to more quickly identify cases and make sure that they're in isolation and their contacts are traced. So it's one that we're watching carefully, but I do not believe that this is going to jeopardize reopening of Calgary, and I again know that Alberta Health Services is working closely with the operator to make sure that additional control measures as needed are in place.
Operator, could you put through the next question, please?
Next is Matt Woodman with CTV. Go ahead, Matt.
Hi, Dr. Hinshaw. We've heard from some businesses in Edmonton classified as entertainment venues like comedy clubs, and they feel there isn't much clarity on what separates them from restaurants other than having people up on stage. So they're wondering, what's the concern associated with having performances like comedy acts or speeches if everybody's properly physically distant and, the microphone is sanitized?
So one of the reasons that those kinds of entertainment venues are classified different from restaurants is, again, partly because of the activities that would happen in those venues. So in a restaurant, again, we've been really clear that it's maximum of 6 people at a table, and that we're strongly recommending that those people who are sitting together at a table be only people in the same household or with the same cohort family. So they're people who would already be in closer contact with each other than 2 meters, and that those tables be separated. So again, you have multiple very small groups of about 6 people, ideally from the same household, who are seated separately from other households, having kind of their own conversation, their own separate interactions. If you have an entertainment venue such as a comedy club or another place where you have people who are gathered together to watch a performance, we know, and I know I've talked before about the fact that singing is something that can project small particles and potentially project the droplets further than 2 meters. And we know that things like laughing or cheering are also things that can cause increased risk of spread beyond that 2 meters. So when you have a performance, if it's a comedy club, if it's some kind of a performance where you're going to have an entire room full of people all laughing at the same time, all cheering at the same time, there is some increased risk to those activities. So again, we're sequencing out different types of activities based on that risk of transmission. And I know that it's difficult to wait. And I know that the encouraging results we've had from relaunch, I think are causing people to wonder, well, could we open faster or more? And certainly, we're looking very closely at the results and making sure that we're watching what our neighbors are doing, and each of the other provinces are opening in slightly different sequences. And so we'll be able to learn what kinds of risks we can avoid, what kinds of things are safe, and we're taking all that information in and continually assessing our progress as we go along. But again, that's the main difference between a restaurant and an entertainment venue, is the actions that group of people are engaged in, which could involve, again, laughter, cheering, some of those things all as a group that wouldn't necessarily be happening in a restaurant.
Operator, I think we've got time for 3 more questions. Operator, could you put the next one through, please?
Next is Laurent Perreault with Radio-Canada. Go ahead, Laurent.
Hello. 2 questions on testing. The first one is, what's our testing capacity right now? And the second one is, why are we not testing more people?
Sure. So the first question, our current capacity is still around 7,000, and that's based not just on equipment, but also on our supplies. So as we've said before, there's a global demand for things like swabs and reagent, and so it is sometimes challenging to get the volume of supplies that we need, and so that can sometimes constrain our ability to do daily testing. The question about why we're not testing more, I would say that what's really important to consider when we're doing a test is the purpose for which we're doing the test. So we are making testing available to all Albertans who have any of the symptoms of COVID-19, the core symptoms of cough, fever, runny nose, sore throat, shortness of breath. And we've also expanded that list. So any Albertans who have any of the more general symptoms that could be associated with COVID-19, such as diarrhea, vomiting, nausea, loss of appetite, loss of smell, loss of taste. If people have a new onset or unusual headache, they would be eligible for testing, new onset of muscle aches or chills. So if people are curious about whether or not they might be eligible, they can go on to the Alberta Health Services website, and there is an online portal for testing, and that is something that will help people know if they can or should get testing. We do encourage people to be tested, but ultimately our public health measures have really reduced the amount of viruses, all kinds of viruses that are circulating. So we do daily polling to understand how many people have had COVID-like symptoms. And when we've asked Albertans how many people have had COVID-like symptoms in the past 30 days, it's only about 8%. So a very small proportion of Albertans have had any of those symptoms. And when we ask them whether or not they've been tested, many of those who've had those symptoms in the past 30 days, which again is a fairly long time, those that haven't been tested, it's because, for example, they have ongoing allergies. So the reason for their symptoms is allergies. Or they've been at home in isolation for a month, they haven't seen anyone, and so they don't actually want to leave for testing because they haven't been in contact with anyone. So I think what's really important to remember is that we're making testing widely available to anyone with symptoms, which is our highest priority for testing. We're also testing in outbreak settings. We're testing close contacts of those who are confirmed cases. And we're doing some additional sampling, such as the Calgary asymptomatic testing, where that's more of a protocol to determine where there might be some population spread. But it's really important to remember that testing many, many, many asymptomatic people is not necessary for us to be able to move out of the pandemic. And in fact, doing samples is helping us get a bit more information about where we can use it, where it's most useful, and where it may not be as useful. So I think, again, we have to make sure our testing capacity is used wisely. We need to have that testing capacity if we should see a surge in cases, whether that's within the next few months or perhaps in the fall. I would also like to remind people that that testing capacity that we've put together can be used not just for COVID, but also for things like influenza. And so all of the capacity we've invested in is a resource that's not just for today or tomorrow, but for the next many, many months, because we will be in this response for a long time. So again, that testing capacity is being used wisely, and it's being used where it's most needed.
Operator, could you put through the next question, please?
Next is Jennifer Lee with CBC News. Go ahead, Jennifer.
Hi, Dr. Hinshaw. I'm just wondering about what your feeling is heading into the decision about Calgary, about how people perhaps are adhering to, in an ongoing fashion, to the physical distancing rules in place. You know, I've heard from doctors who have concerns that as these restrictions are easing, people aren't adhering to them in the same way, the physical distancing rules, guidelines, that kind of thing. So do you share those concerns as you look to ease up in Calgary? And if so, I mean, how would you address that concern? Is there a way to strengthen rules or potentially mandate masks, things like that?
So I haven't necessarily heard reports that that there are significant issues in Calgary or Brooks or elsewhere in the province with people choosing to not follow the distancing rules anymore. So it sounds like, there certainly are reports that you've heard that some of those things have been flagged. But I think what I would say is that when we had our first weekend of relaunch last weekend, I know that from the business perspective, at least in Edmonton, I heard that the reports from our team here in Edmonton with respect to the environmental public health teams going to businesses that were newly opening, and what they saw was that many businesses were following the appropriate measures. Some businesses were not, but they were very amenable to the guidance that was provided and the recommendations that the environmental public health team had for them. So I think that it's important for all of us to remember that this isn't going back to business as usual the way it was before. And we do have some of our teams out in the field making sure that businesses have that reminder, that they know where they can find guidance and resources to help them keep their staff and employees safe. And I know that one of the things we also need to remember is that in the past, we've seen respiratory viruses decline over the summer. So while we don't know for sure if that will be something that helps us with COVID, it's reasonable to think that we might get a little bit of a break over the summer as we are outside more often, knowing that the ability to stay 2 meters apart outside and having that good air circulation and less surfaces to touch may actually help us over the summer. But I think it's really important for people to remember and to not get lulled into a false sense of security, to feel like COVID is over or that the pandemic is over. Even if we are able to control it over the summer, we need to remember that moving into the fall, we always see a spike in, for example, influenza, other respiratory viruses. So we just need to continually practice the good public health measures. I'm not sure that, again, additional enforcement is needed at this time. Rather, this is a collective effort that we all need to remind each other of the importance of this, of building these good habits, of preparing to keep them in place over the long haul. And that will protect us not just over the next few weeks in relaunch, the next few months into the summer season, but into the fall as we anticipate, again, not just potentially COVID, but other viruses starting to come back again.
Operator, could you put through the final question, please?
Final question is Lauren Boothby with Post Media. Go ahead, Lauren.
Hi, thank you. I was just wondering if we have an update on outbreaks in Edmonton hospitals at all.
So there were a couple of very small outbreaks, and I will remind people that the definition of an outbreak is even one confirmed case that could potentially have been acquired in hospital. But there were no additional cases that were identified in those sites in Edmonton acute care. And so it's my understanding that those outbreaks have been declared over. I will confirm that, and we can get back to you afterwards. But again, those were precautionary outbreaks that were declared, and no additional spread was seen, and I believe that they've been declared over.
Lauren, we'll give you an update as soon as possible. Thank you all for coming, everyone. Dr. Hinshaw will provide another update on Monday afternoon.